The birth of a child is a time of hope and expectations, yet many complications can arise. Fortunately, care for infants before and after birth is a rapidly progressing science. We visited Children's Hospital of Orange County and asked Dr. John Cleary to tell us about modern developments in pediatric cardiology.
It's probably one of the leading places in medicine where the pace of change has just been fairly amazing. A lot of people know about small premature babies and how much that has changed, but the bigger babies, and specifically what we call congenital heart disease or babies born with heart problems, that pace of change has been impressive. About 1 to 2% of babies are born with some form of heart problem, and the common ones, the simple sort of hole in the heart that grandparents might talk about, which to us might be called an atrial septal defect or a ventricular septal defect. The surgeons have been able to deal with those well for years. And there is some progress and changes on how those common things are treated. But heart lesions, which 15 or 20 years ago, we might be telling a family there's nothing we can do, turning into heart problems that there are standard dramatic surgeries that can support them. I tell parents all the time that babies do tell us what to do. It's just you have to observe and listen different than language. We think of pain and agitation as a fifth vital sign. So just like the nurses are monitoring the heart rate and the blood pressure and the oxygen levels, you can read based on their vital signs, based on their facial expression, whether they're in a good state or if they're in pain. And if in doubt, you treat pain aggressively. That's a change in medicine. There was a time when people would pretend that babies didn't feel or remember pain, and aggressive treatment of pain, refinements of anesthesia are part of why babies are doing better. With heart disease in a baby, sometimes it's not just the experienced clinician's eyes, but we have better monitors to allow us not just to look at the color of the skin, but to use techniques to know how well is oxygen getting to the brain, how well is blood flow going to the kidneys, sort of unique and refined monitors that let us listen to the baby. Am I doing well? Leave me alone or turn down my therapies, or my heart function is borderline, I need some help. And rather than waiting for their blood pressure to fall or waiting for there to be a problem with their heart rate, we can listen both to their examination, their vital signs, and some of the newer monitors can help us respond earlier and prevent problems. Neonatal care and cardiac care is such a team game, so it's not just me preparing the family. It's bedside nurses and nurse practitioners, it's social service experts, we have experts on storing, preparing, and learning how to breastfeed, for instance. So working with that family is very rewarding. There are heart problems for which we used to offer no hope or very little hope, like being born with just one ventricle, that now survival is over 80%. So huge successes, even our most challenging lesions having a far greater survival. But that brings a whole other set of challenges in terms of trying to balance technology with quality of life. Can we make patients alive but with an even better neurologic outcome, with fewer surgeries, with fewer complications? So tremendous success, but ongoing challenges and opportunities to do better.